patient and I say, hi, my name is Danae. I'm a Cedarville nursing student, and today I'm going to be inserting an NG tube. So it's not going to be very fun, but we're going to get through it together. So I'm just going to get the bed raised up to an appropriate height. You tell me your name and your date of birth. Thank you. So it should just take about 10 minutes for the whole thing. So if you have any questions, let me know. I'll just feel free to stop me anytime during the procedure. So I've checked all my doctor's orders and everything, so I'm sure that they are supposed to get an NG tube. So first I listen for bowel sounds. And bowel sounds are present. Also checked the bed break when I came in. That patient's safe. So I've got all my tape ready, so I'm going to wash my hands and put my gloves on. Get ready for the procedure. So I'm checking for any imperfections in the tubing and getting it stretched out. Okay. That's all good. Okay. Then I have lubrication. I'm going to lubricate the first 4 to 5 inches. And then I explained to the patient how I'm going to do this. So I have a glass of water here for you. So then first I'm going to have you tip your head up, and then once it reaches the back of your mouth, you're going to tip your head forward and swallow as I push it down. So if it's uncomfortable, well, if it hurts at any time, I'll just stop and we'll slow down for a second, but then we're going to keep working at getting it down. So, okay, so here we go. And now start swallowing.
If I miss something huge.
And I'm going to withdraw because I realized I forgot to measure. So then I would obtain a new NG tube and check it all again, and then start over. And so I'm going to measure from the tip of the nose to the earlobe to the xiphoid process, and mark that spot on the tube.
No, because I'll sit in your elevation. Okay. Alright. So I can check. Are you ready? Is it recording? No. Okay. Go.
And then everything would be the same after that. So same instructions as before. Start again. Okay, now swallow. And it's hitting resistance, so on a normal patient I would withdraw and continue, but it's just not working on the mannequin. So I'm just going to say I got all the way down to where I put my tape. So I'm going to go ahead and anchor it.
Is it lost?
So I'm anchoring it, making sure it's not touching either side of the nostril. Before the procedure, I've assessed which nostril I would have used, which one was the most patent, and the patient's ability to cooperate and swallow. Right, so now that is anchored, and so I'm going to do my checks to see where it's at. So first I'm going to auscultate for a bubble to see if it's in the stomach. Gastric burp. Okay. And then I'm going to withdraw 5 to 10 milliliters.
Try to do it as quick as I can.
And where's this cup? Put it in here. And then test the pH to make sure it's at an appropriate level. And then I'm going to put back in any of the contents that I took out. And then I'm going to measure the distance from the tip of the nose to the end of the tube and record that number. And then I'm going to make sure that I document that I placed the tube and when I did all of that, and then make sure that they get sent to X-ray. Okay. And I'm just going to continue on into feeding, so I would have come in and done all of my regular safety checks and introduced myself and identified my patient. But I'll just continue on to feeding now. So I would do all my other checks again. First I'd make sure that they did have an X-ray done. And then I'm going to auscultate for a gastric burp again. Okay. And then I'm going to measure again to make sure that the length is the same as what it was before. And then I'm going to check the stomach contents. So I withdraw all of it and then measure how much is there. If it's over 150, then I'm going to let the doctor know before I continue with the feeding. I'll also check the pH of this to make sure that it's correct and replace all of the gastric contents. Okay. And then at this point I would get 30 milliliters of tap water to make sure the tubing is clear before I begin the feeding. Okay, and I have my feeding formula, so I'm going to check the date and make sure it's the prescribed food that we're to give the patient and let it come to room temperature first. So I've checked all those things, and I'm going to raise this and pour in the prescribed amount. And I would raise and lower to increase the speed or decrease the speed, and then pour in without letting any air get in between each time. And then to finish, I would put another 30 milliliters of water through to clear the tubing. Take that out and put a plug on the end and reattach the tubing to the patient's gown, which I don't have a safety pin, so that would attach there. Alright, and then so I would put them in mid-Fowlers for at least an hour after each feeding and record the amount and when I gave the feeding and how the patient tolerated it. All right, and then discontinuing, I would also make sure that they had bowel sounds before I gave the feeding. So that was something I would monitor throughout while the NG tube is in. And then removal, I come in and first check to identify the patient because I don't want to take the wrong one out, and make sure the doctor's orders say removal and all of that. So then I give the patient a tissue, and then I'm going to flush the tubing with 30 milliliters of air
Put it in my cup.
to clear it. and then I'm going to remove the tape and tell the patient to hold their breath, and I've reassured them this is much less traumatic than when I inserted it. So just hold your breath and we'll take it out. And it's out. So then I would throw all this away, and then I would continually assess the patient for bowel sounds and how they handled the procedure. And then before I left the room, I put up the side rail and lower the bed, check the brake, and ask them if they have any questions or if there's anything else that I could do for them.